how to switch young guys from illegal PEDs towards legal TRT.
Yeah, and that can be tough because if they're using PEDs and they're getting results and they're using it for either their sport or their career, it would be lying to tell them that they could continue to see the results that they're getting with the abuse of PEDs on TRT. Though if they're like me, like my story is that I abused PEDs for a long time. And then I got to a point where I realized that it just wasn't beneficial for my life in any way. And it was more detrimental. And I wanted to focus more on the longevity aspect of things. And that was the easy switch over to TRT, which I knew to be much healthier and much more aligned with my longevity goals. So a lot of the times I'll have a conversation with the young guy too, is that, do you think that what you're doing now is going to be what you want to continue to do for the next 10 years? You're 24 now. Do you think you're going to have the exact same goals that you have when you're 34 and when you're 34, when you're 44? And if they can't think of that, I say, okay, think back to when you were 14. Are you the same person? They're probably not. So if they're hurting themselves in the pursuit of thinking that they want to achieve this physique with PEDs, it's probably good for them to realize I'm not the next Mr. Olympia. I probably will never receive a contract for, a supplement company to pay me to do this. Maybe I should step back. And then we can have the conversation that, if you have optimized testosterone levels in a natural range, a higher end of normal, that's still healthy and coincides with longevity, and we get you on a good training protocol and nutrition, you can actually still make a decent amount of gains. In fact, I had a guy who had been on PEDs for 20 some years and came to me saying, I'm done with this. I don't want to do this anymore. I don't actually feel very good. I've never made anything out of this bodybuilding career. And, his cruise dose was like 300 milligrams of testosterone. And so when I told him I'm going to drop you down to 150, he was pretty afraid. He thought he was going to lose all of his gains. I was going to feel awful. I got a text from him yesterday saying that he feels the best he's ever felt in his life. He hasn't lost 1 pound of muscle. He still looks great, but now he's functioning good. His relationship with his wife is good. His cardiovascular is good. He watches ApoB get cut in half. His A1C is improved. So I think it's just being realistic with what your goals are, and then realizing that you may not be the next Mr. Olympia, but we can get you to feel good, look good, and thrive.
Mm-hmm. Yeah, and practically, how to go about that? Do they first have to stop everything, so they have very low testosterone levels to be able to get on to TRT in a legal way, or is there a gradual way to transition them from one thing to the other?
Sure. Yeah, I think that's probably going to depend on where the patient goes and the provider that they see. So unfortunately, as you know, not a lot of medical doctors these days are really trained in TRT or fully understand it. In fact, I've even seen people get put on TRT by their endocrinologist, and then their levels are good on a lab, and so they tell them they can come off now, which baffles my mind that they've never heard of a negative feedback loop and that they've now suppressed this person. But it's not uncommon. And in fact, insurance companies are the same way. As soon as they see labs are okay, they'll take the patient off of testosterone. So it kind of depends on who you're going to. If you're going to, just your GP or somebody who doesn't understand and they see your testosterone levels are at, let's say 2000 nanograms per deciliter because you're on PEDs, they're going to say, no way, you don't need testosterone. You just need to come off and you'll be fine. Now, if you come to somebody like myself, like Merrick Health or other clinics that understand, then yeah, I think at that point we just transition you over. And I like that, that's easier because I know that I can't get this person off, but I can give them pharmaceutical grades, testosterone replacement, dosing. And so, yeah, it really depends on where you go. And that's why it's important to go somewhere where the people actually know about bodybuilding, about PED use, and more importantly, about TRT and what it's all about.
If you wish to support the channel, consider becoming a channel member. And check out the links in the description of all the things I'm associated with. My ebook on compounded testosterone cream, multiple workout programs, Mizumi skincare, online pharmacy NP labs, and a list of Amazon links to the supplements we recommend.